What if I told you that something millions of seniors take every single morning, something marketed as safe, natural, and essential, could actually be making your health problems worse over time? I know that sounds too simple, and you're probably thinking, I've heard this before. Another warning, another headline, another scare tactic, and I understand that skepticism deeply because almost every patient who sits across from me says the same thing. They've tried the supplements, they've followed the diets, they've listened to well-meaning advice from friends, TV doctors, even pharmacists, and yet their numbers don't improve, their energy doesn't come back, and the frustration just keeps growing. My name is Dr. Laura Bennett, and I've been treating patients in their 60s and 70s for over 22 years. I'm a physician, a woman, and a doctor who has spent decades watching smart, disciplined, responsible adults do everything right and still struggle. And today I'm asking you to hear me out, because what I'm about to explain has helped many of my patients see improvements of up to 30 to 40% in key health markers, simply by removing one daily supplement they believed was protecting them. I'm talking about men and women who take their medications faithfully, who walk every day, who limit sugar, who read labels, who spend hundreds, sometimes thousands, of dollars a year on supplements because they want to stay healthy, independent, and present for their families. They're exhausted from trying, they're tired of being vigilant every single day, and many of them tell me quietly, almost apologetically, "Doctor, I'm doing everything I'm supposed to. Why isn't it working?" Before we go any further, I want to hear from you. Please take a moment and comment below with the country or city you're watching from. I read those comments, and it helps me understand who I'm speaking to. And let me be absolutely clear right now. This conversation is not about replacing your medications. This is not about stopping prescribed treatment. This is about safely supporting your body so that what you're already doing can finally work the way it's supposed to. After the age of 60, your body does not process nutrients the way it did at 40. That's not a failure, it's biology. Digestive acid decreases, kidney filtration slows, liver detox pathways become less efficient, and your cells become more sensitive to overload. One of the biggest changes we see is reduced clearance, meaning substances stay in your system longer than they should. Add to that decreased thirst signals, subtle dehydration, and slower metabolic turnover, and suddenly things that were once harmless can quietly accumulate. Here are 3 changes that matter deeply. First, absorption becomes unpredictable. You may absorb too much or too little of the same substance on different days. Second, excretion slows, especially through the kidneys. Third, cellular sensitivity increases, meaning your tissues react more strongly to the same dose. And here's what most people, including many healthcare providers, completely miss. Combining these changes with daily supplementation can create chronic low-level overload that never shows up as a dramatic side effect, but slowly worsens blood pressure, kidney strain, nerve irritation, or fatigue over time. Even mild symptoms, slightly higher numbers, occasional dizziness, disrupted sleep, unexplained anxiety, muscle weakness, can add up measurably over months and years, not overnight, quietly. Let me tell you about Margaret. She's 68. She sat in my office and said, "Dr. Bennett, I don't understand what I'm doing wrong." She was taking her blood pressure medication, walking 30 minutes a day, eating low sodium, tracking her readings, and taking a daily supplement she'd been told was heart protective. Her husband was worried because she seemed more tired and irritable, and her numbers had crept up despite her discipline. I asked her one simple question: "When do you take your supplements?" She answered, "Every morning, first thing, with my medication." That was the moment. The issue wasn't what she was taking. It was the timing, the daily accumulation, and her hydration window. Her kidneys were being asked to process too much, too early, with too little fluid. We made a few very specific changes. Exact amounts, exact timing, water temperature, nothing dramatic. 2 weeks later, she called me, and I could hear it in her voice. Clearer, calmer. After 1 month, her systolic pressure dropped by 12 points. She laughed and said, "I honestly thought you were a little crazy, doctor, but it worked." Before I teach you the method I use, let me explain the 3 most common mistakes I see every single week. Mistake number 1, assuming more is better. That's like adding more oil to an engine that's already full. Mistake number 2, taking supplements without water strategy. like watering a plant by pouring water on dry concrete and wondering why nothing grows. And mistake number 3, ignoring timing. Because your body's processing capacity changes dramatically throughout the day. This brings me to what I call the CLEAR method. C stands for cut unnecessary daily supplements. L is load hydration properly. E is establish timing. A is adjust gradually. R is reassess with data. Phase 1 happens in the morning. No supplements on an empty stomach. 12 to 16 ounces of room temperature water within 30 minutes of waking. This supports kidney perfusion and blood volume. Phase 2 is midday. If a supplement is medically appropriate, it's taken with food, with at least 8 ounces of water, never stacked. Phase 3 is evening. No supplements that stress the kidneys or nervous system after 6 p.m. Scientifically, this works because it aligns intake with peak filtration, reduces renal strain, and prevents accumulation. Physiologically, it lowers background stress hormones and improves cellular balance. Robert, 72, came to me exhausted. His A1C was creeping up. He started with just one change, stopping a daily supplement he didn't actually need. 3 weeks later, he said he felt genuinely different. His labs confirmed it. Eventually, his primary doctor adjusted his medication downward. Now, practically speaking, patients always ask, how much water? How often? Here's the simple rule. Body weight divided by 2 equals ounces per day, spread evenly. Bottle by your bed. Reminder on your phone. Week 1, you may urinate more. Week 2, energy stabilizes. Weeks 3 and 4, numbers improve. Long-term, patients tell me, Doctor, I just feel better overall. Let me be absolutely clear about something critical. This is not a replacement for medical care. Do not stop medications. Continue following your doctor's plan. If you have kidney disease, heart failure, or are on diuretics, consult your physician before making changes. Finally, I want to tell you about Helen, 74, 15 years of struggling, fear, hopelessness. She cried in my office. We changed her routine slowly, gently, safely. Months later, she hugged me and said through tears, I wish someone had told me this years ago. So here's my challenge to you. Try this method for 14 days. Cut unnecessary daily supplements. Hydrate strategically. Track how you feel. Comment your progress below. If you made it to the end, type CLEAR in the comments. Tell me your biggest struggle. Share this with someone you love. Subscribe, turn on notifications. Small strategic changes done consistently create genuinely measurable results over time. This is Dr. Laura Bennett, and I'll see you in the next video.